All right, so, okay. Before, nope, not yet, not yet. Don't jump the gun on me. I always ask a question. I've asked this before with every other patient, which is on a scale of 1 to 10, 10 being the worst pain ever, 1 being least amount of, no pain at all. Where are you at right now?
0 right now.
It's pretty kind of crazy, right? Yeah, people don't believe that, done the right way, this is not a surgery that really is very painful. And also testament to you guys. Thank you for taking good care of him, making sure he took his meds and kept you on the right path here. Okay, so what we're gonna do first is I'm gonna let you go ahead and turn and take off your mask and show these two beautiful people here with you. You're smiling for the first time.
Wow. They look so good.
Yeah, that's crazy.
Isn't that awesome?
Yeah, that is pretty awesome. Looks good.
Okay.
Smile.
Give him a cheesy smile. There you
Having a
go.
hard time.
There we go. Yeah,
They look
those are
really good.
perfect.
Okay, you ready to see him? Go ahead and put the mask on, then I'll just scoot up real close, and then if you'll go ahead and scoot up real close, and then go ahead and take a look. Go ahead and take it off. All right.
Wow. Looks good. Oh yeah, it does. Way better.
Look a little younger there.
Yeah, for real. No beard and no holes in my teeth. Thank God.
So when you're talking, notice how you're showing lower teeth now, or sorry, upper teeth instead of just the lower. That's one of the biggest things I want to change on you. I'm gonna swing around here. Go ahead and turn around. Let me get a. Go ahead, it's not really big. I love them. They look awesome.
They look way
So good.
Okay, do you have questions?
No.
So biggest thing I was telling your son is we got to make that big commitment to the smoking.
Yeah.
I told him I'd rather be like a 5-year investment. I want this to be a lifetime investment.
Right.
Some people I've seen have got away with smoking, but I don't think you're one of them.
No.
We put those 2 extra implants in the back just to be safe, and once they're all healed up, we'll attach. They were attached this morning, right? And I thought I took them out, and the second set, now they're not attached.
Right.
We'll let those heal, and then we'll be able to attach into those in the end.
Yeah.
But these are the ones you have in there that we put in originally. They're completely healed. They're it's just that they've lost bone due to the smoking.
Yeah.
And so
I'll get rid of it.
now he looks so young, right? Without the beard and then the baby face.
Yeah.
Yeah.
It's awesome.
Even if I gotta go on Chantix or something to get rid of it. Yeah.
Mm-hmm.
If I can get out of that truck for a month or two, I'd be in great shape.
Yeah.
I know it's hard. I get it. And the truth is I don't judge people. We all have our things that so every one of us.
Yeah.
There's not a single person in this world that doesn't have some type of vice. And so but this might be the right leverage to get you to make that final decision just to kick it, because I think that otherwise, like I was telling them, I just think that over the next 4 or 5 years, those top ones will start to, if they continue to lose bone, there's just enough anchoring them.
Right.
So now the other thing too is the hygiene. Just make sure that maintenance wise, you want to get that. You said you already ordered them, the water pick and the spin brush. Okay, get right up in there. Don't be shy.
We're gonna send you a post-op letter, really good letter that we came up, or that Dr. Hendricks put together.
It's all we.
Nope,
good.
it's him.
Yeah.
He did it.
It
So
just- it
I'll
just
send it
explains,
to
like,
your
what you-
straight to your email.
Yeah, it just explains what what to do, and we can't control everything in life. I wish we could, because I would be much happier. I think that's one of my things in life is trying to come to grips with the fact that I can't control everything. But what we can control is, in this scenario, would be what we eat,
Actually.
staying on a soft diet for the just next 3 months, and then hygiene. And that comes down to just making a daily habit to water pick, to spin brush, and at least a weekly habit to do the floss. Right now, it'll be tender to try to get under there, it'll be probably too tight, but once you get 2 or 3 weeks out, the inflammation should go down and you'll have more room and you can start to floss also.
Yeah.
Okay. Okay. What I didn't tell you, or I didn't talk about a lot yesterday, is when we went into the top yesterday and we put those implants in. I also went and I actually sterilized every single implant. Eventually there'll be a YouTube video that I'll put like YouTube short about it if you care. But essentially the threads that were exposed, I went in and I basically prepped those threads, or in a sense like took off the layer that had bacteria on it, and basically kind of hit the reset button so your gums would attach to it. Because that's the thing, is when there's bacteria on something, the gums don't like it, and then that's what causes the bone loss too. So it's like smoking, and then just a little bit of bacteria that can, and I'm hoping that's kind of the compound effect that caused it. But at the end of the day, everything is perfectly clean. So now we just got to make sure that we don't allow, think of it like a ship that just got, and I don't know ships that well, but I'd like to get the ships on this. But I always have these crazy scenarios I do live, right? I don't know where I'm going with this one, but I think imagine if I was a ship person. And there was all these barnacles and stuff that collect underneath the ship, right? I know every so often I have to take them into port and they pull them out, and then they basically take them all off, right? They basically like just shell it all off, and it all comes off, and they polish it up. You basically have a ship that is polished up, and as long as we don't let that first layer of barnacles get on it, it'll stay that way. And so that comes down to just like we just hit a reset button, and I think you're gonna be fine.
Well, that's why I bought that portable.
Yeah, portable will be great.
Because trying to carry that big one.
And remember, the water pick alone is not enough. Remember, you need a spin brush too. Why? Because water helps push stuff that you can't see, but everything that you do see, that's what you use the spin brush for.
Right.
Right? That's like the polishing, like Miyagi's kind of stuff, right?
Well, like I say, I think I was just using them wrong.
Yeah. So again, we just changed a couple different things, and I think that we have a different formula, and we'll have a different outcome. And so, but I really like the aesthetics. You notice that when you smile, your smile's a little asymmetric.
Yeah.
Has that always been that way?
I don't know.
Not been much of a smile.
You pull just a little. Oh, here's before. Here's before and afters. So notice how like when you in here you can see it a little bit too, but see how you pull a little bit more on this side.
Yeah.
Now that could be just because over the years, psychologically, you've been kind of like kind of limping in a sense, or like guarding it.
Right.
And so my hope is that you get that confidence back, and maybe it's just a muscle that just needs to be worked out, right?
Yeah.
So like an emotional confidence, maybe you start and that evens out. So that's one of the reasons why I thought it was a good idea to do it now, so I can see how it's going to be in a few months, and so we could compensate a little bit. But this right side, the envelope is a little bit bigger. But I'm not sure if it's because your muscle. Sometimes people will have like a stroke. You never had a stroke, right?
No.
Yeah, sometimes stroke victims will have one area that's a little more paralysis.
Right.
But at the end of the day, I mean, it looks great, but we'll kind of try to get that evened out more. Questions?
So I sent you a picture a while ago when we first started this, me at about 18, 19 years old.
Mm-hmm.
I don't think I had that asymmetric smile.
Okay.
Does your bite feel okay?
Yeah, you probably can't bite down yet.
Well,
That's pretty even bite right now.
your bite, like. Yeah,
It's
they
more
look
centered.
like
I mean,
the
and just know these teeth are they have training wheels on them,
bite.
meaning that they're not meant to cut.
Right.
They're just touching lightly. They're more for glamour and looks.
Right.
When we get to the final, then I can make them sharp and make them really cutting, right?
Yeah.
But that's the question: is if that smile, these implants are where the bone is, and so they're pretty symmetrical. I feel pretty confident that way. I think, and it could just be that you're just not used to smiling, and you just kind of, some people will pull down on their lower. Like I don't think it's so much that you're asymmetric on the top, it's when you go to smile, that side just kind of comes down a little bit more, and that could just be literally just a muscle that's not been pulled, right? You just gotta work that muscle.
Gotta exercise.
So when you smile every day, just tell everyone like, look, I smiled.
Yeah. We'll
Yep.
get there.
Do you have other questions?
No, I think we're in great shape.
Are you happy with the outcome? Good. And I know that I've been very direct with you. You know it comes from love, right?
Yeah.
I just want you to know, like I mean, the smoking thing, everything. I just want these to last forever.
So
So
you're a doctor, you're in a position, you gotta get a bit harsh.
I hate it. It's the worst thing about being a doctor is having to have the hard. I make her do the hard things usually. Megan, I don't want to go talk to them. Go. But there's some things that you just can't delegate, and so. But I think we're back on track, and I think we're gonna be okay.
Good.
Alrighty. You guys have any questions?
I don't think so.
Okay,
So his
cool.
next visit actually be cleaning?
So the next visit will be just